So this is a pause here on Journey. Let me take you to the Ashanti Regional Capital, Kumasi, where President Akufo Addo is continuing his tour of the region. He's commissioning some hospital projects in the region. Let's listen in now.
You see in that dano, not yet the Yama for enough group. And they are hospital by no more money demand and supply. Demand no high. It ye best say mobile ye transformer no for Frama hospital no. Problem only too many pa no. Kasia pa no. It ye no man penny waha. Na ye MP waha. Na ye DC waha dia. Near ye just ye weekula. It would be a sremo transformer no. Monche na monmaye transformer. A bit me a supply BBA. Na the road system no. Ye nimse year of rose. Ghana had ye by bia anyabi. Year of rose. Na the year sense ye wo kwan ba akope. Efiri oboase eba boase nkwanta. Asokwa junction. Eji efua ya besi kwabrakwa. Akabe 4 kilometers. 4 kilometers kwa minyini se ebedu. Eti eno de asokwa DC MP owa asokwa na omampani wa haide ye besre se ekwan no momfa nto ho mayen na fomna de me ba ye 2014 yesi ya ye fomna kwan nyina yesi ya ye overhead nyina overhead enti ye wa ha na piak for ba se o mo ba be hwe se ekwan no ayesi ya ye no ani overhead na ya ye no ye ni ye ana se ya anye ni ye o mo ba ye nso no ye kire won se abi anye form na we ya ko form na ba ko wo Cape Coast ya di won ko gina abonten no ya hunu kwan bia ya ye no form na ya hunu overhead bia. This was 2014 na me ba ye nkyere eti yesre se ebia monkrata mu de munim se ya ye fomna kwan nyina anso obia me ye fomna kwan eti year of rose no ye wesre president ansa na abeko no yesre wo se ye road system, internal road system ani asokwa de ye amakan ana anomabo se ye ufiri asokwa wo konkran ya ka wo fa anomabo a na kofodua ni na nkran ya ni bridge ba ko bi wo hono mo a asa free tete ti esrese river num hono bridge no a separate adanse ene eastern region no ye besrese mo betumi ayama we de mo yama nya danse nko a Asante ni achim na mo yama yen enti no ye besrese me de ma no sie no na me bo hoye sa bridge no ye besre se obetumi ahwe aye amane a ye beda wasipi
Monica sa wanu hwam you read that say pacho mo esem.
So those are live pictures from Fomena in the Ashanti region where President Akufo Addo is touring, and he's expected to commission some hospitals in the Fomena and of course the Kumau township, different towns in the region. And when the president is about to address the gathering, we'll bring that to you live from Fomena in the Ashanti region. This is part of the tour of the president in the Ashanti region. So we'll take you back to the community where the health minister, the other ministers accompanying the president will in turn speak before we have the president speak to the gathering. The health minister is addressing the gathering and we can listen in.
And also would like to thank the Almighty for the precious gift of President Akufo Addo in our lifetime. Mr. President, Ghana signed a contract with Messrs NMS Infrastructure on the 19th of November 2012 for the design, construction, and equipping of 7 health facilities and the provision of an integrated IT system. The locations chosen included Dodowa, Fomena, Komewu, Garu, Sekendi, Abetifi, and Takrady at a project cost of 175 million US dollars. Mr. President, it is refreshing to mention that these projects experienced some headwinds between 2012 and 2015. But under your leadership, your government worked hard to make sure that the necessary resources are found to complete the projects. This hospital is equipped with state-of-the-art medical equipment and specialized departments designed to provide comprehensive primary health care. The hospital has 120 beds and offers a wide range of services, including outpatient services, inpatient services, that's medical and surgical, pharmacy, accident and emergency diagnostics, that's imaging and lab services, 2 theaters, surgical theaters, an obstetrics and gynae private room, traditional stroke alternative medicine department, a public health department, medical administration, catering, laundry, and sterilization facilities. It's refreshing to mention that this hospital also has 25 accommodation units for staff of the hospital. Your Excellency, in addition to this facility, many more facilities have been completed or are being worked on by your government in the Ashanti region specifically. Mr. President, the Kofanoche and Teaching Hospital Maternity and Children's Block is ongoing with a bed capacity of 507 when completed. Your Excellency, the Ashanti Regional Hospital at Sewia, a 250-bed facility, is just in the process of being operationalized. The Ghana Health Service is working with partners to make sure that the facility is operationalized so that that also can be inaugurated. Your Excellency, we have other facilities such as the construction of the trauma hospital in Obuasi. We also have the Ashanti Region Municipal Hospital in Konogo, which is completed and is currently in use. Mr. President, we also have a 120-bed facility at Kumewu, which your good self will be inaugurating this afternoon as well. Your Excellency, Bekwai has also had their municipal hospital completed under your regime and is in use. Tepa has a 60-bed facility. Sabronum also has a 40-bed facility, which is completed and is about to be operationalized. Suame, Mr. President, has a 40-bed facility that will be operationalized very soon. Drobonsu also has a 40-bed facility. Mr. President, I'm also excited to mention that the military hospital at Afari, which has 500 beds, 500-bed capacity, is also ongoing and by the grace of God will be commissioned and operationalized this year. Your Excellency, I'd like to specially acknowledge Dr. Kunedu Abinayosin, who is the medical soup of this beautiful facility. Mr. President, many actors under your leadership have worked hard to make this hospital possible. And I'd like to especially acknowledge my predecessor, Honorable Kukua Chimameno, Dr. Nsia Sari, former finance minister, Mr. Ken Oforiatta. I'd also like to acknowledge the MP for this community, Honorable Isiama, who presided over the sitting that approved the loan facility that made it possible to complete this particular hospital. Mr. President, last but not the least, much gratitude to you, your modest self, under whose auspices and direction all these facilities, which were at an average of 30%. Mr. President, by January 2017, when you were sworn in, all these facilities under this NMS project were at an average level of 20% completion. You didn't abandon them. You worked hard to make sure that they see the light of day, and that is worth mentioning. Your Excellency, by January 2025, where by the grace of God you'll be handing over power, Mr. President, the Ashanti region is expected to have about 2,000 beds added to their health infrastructure capacity. Mr. President, if you add those on Agenda 111 list for the Ashanti region, you are looking at close to 3,000 beds addition within an 8-year period. Mr. President, certainly history will remember you not only as the education president, but also as the health president. I'd like to conclude by thanking the good people of Adansi North for all their collaboration, cooperation, and support. I'd also like to thank again the MP for this community for all his support. I'd like to thank the MedSoup for this facility, Dr. Abena Yossi and his staff for all the hard work. And finally, I also like to thank Dr. Kuma Bwaji and his team in Ashanti Region for all the work in operationalizing this hospital. Thank you very much, and may God bless you all. Thank you very much.
Yada Health Minister Ase Sabri Akuska.
So next to speak, obviously, will be President Akufo Addo. This is one of the Agenda 111 projects that government started, and the hope is that it will help address the health needs of residents within the enclave of Fomena. And when he's done, he will move on to Kumau to also commission another one. As we heard the health minister, we are waiting to hear the President Akufo Addo speak to the community, and then the official, commission will be done. And then it will go a long way to help the community. This are live pictures coming to you from Fomena in the Ashanti Region. President Akufo Addo is on tour. He started this tour some 2 days ago, where he inspected works at the Swami Interchange and some road projects in the region. Today, the focus is on hospitals, and he is currently at Fomena in the Ashanti Region. From there on, they will move to Kumawu. Very soon, we'll hear the President speak, but we can listen in to the appellation ahead of the speech by the President.
Oh yeah, dear, yes, yeah, dear, yes, mention Abu Dani Addo Dankwa Akufo Addo. Dance minda wasia bro, Santa minda wasiansa. Ghana minda wasia wakudonto. Nana, yes, west, enka yenshia wanka yenkoto je eka yenkoko. Sukwanko. Yen shia wanke didie boyen achem kwana na wunum bremu oyoko de shekonkura sansa wofa dia wode chira wofa nso ofa ne bom adanse man say amanyoku obi etwamu so de aso ebo fama de say ye twen ema enwaw etumirika ansa Anna wabeye nanso wasi adia yo adudi adu soboy adu preman nana ado dankwa Akufo Addo de wasi oyo waye bida wari akokono ase yenso wabari chiremre kukua chinjefo ne hwan ware kwato ase yenso wabari kura hwan ni chinjefo nana ado dankwa Akufo Addo oya washa body bosha so ono na washa yambo se obema ya 1 district 1 factory 1 constituency 1 ambulance obema ya online passport application paperless pass and so wow wa ye bianca Agenda 111 oguso ye wadom ye zongo development fund and then jesem ya wa bofrato wa inge ya bema ne Ghana card nana ado dankwa Akufo Addo wa ye bianca edrumrebi national health insurance nanka yemfa nyashe nanso nana ado dankwa Akufo Addo ba ya no national health insurance eye ejuma na ni jesem ne se Addo be menyansa ni nyansa bisa kwanta bisa nyansa bu akwa nyansa bu nkama kenta ne so nana wo si brekete ti brekase she eno so national health insurance wunne na wo renew ene ebeye adwuma ene nana Addo dankwa Akufo Addo waye bianca says 60 state houses who says si judges adanya hodo ama judges baby de wonti ato nana yenya wudeni nana woye bue nana wanim ne wachi obi ani ho wodamufua ankasa nana obeye nkaye dum ama Ghana mine free sa wasaso padie ebini baby adanse mine say she aku eya wo say kakra bi na waye bra ya kwan de nana Addo ebrumre bi na nka adanse mine baby wo ho a ade aye fra ne asphalt kra na nka enima de kro nanso nana Addo dankwa Akufo Addo baye ekwan na da sojo ekojo nana Addo dankwa Akufo Addo free kusa ekopem dichie na waye me bisaye me so honorable DC erikusi asehwe ena de adanse wo ba ye mfati paye duro ene sisi yade anka ho free se nanado waye akwan ni nyina uni sisi yade atonkwanta wapai every se waye chiaboso ekwa akopem akrokere anso ho a waye kwa apia akwa akosi baby bebre so anso ho a waye sodua akwa akosi bena anso wa omse na wo musu afadompu ase ofadompu ase afa hensan wudura hensan ya na wadura ajokwai na wa ye ho nyina omse afa bobrase ofa bobrase wia no afa nyina brem ofa nyina brem ho wia na wakoda gen ehwo na obehu sampa wada gen adanseman ho na Addo dankwa Akufo Addo eba schools a ebinom se na ado ye free SHS nanso adan ben na wasisi na omose nimdie nanso wodie wadwene ka adwene ne kleke woni animdifo woyɛ wo manimfo enu nti school pa wontu na jeje mu wo borra bobrase da gen chechirewre anso hwa wo borra wioso wo borra medoma wasisi 6 unit classrooms nyina wo baabi amabobodo eba police station so a medoma wa mayebi akrokeri wa mayebi nana mo abru mo so wo borra asaribedi akon senior high school asaribedi akon for say wa ma wo 400 bed capacity of boys dormitory and so what's our 600 bed capacity of girls dormitory and so nana adunya nseni wo barati I for mena amasa almost say wa 450 boys dormitory nana why biankasa eho ena ko kare college education se share Bora yanso yaho nana Addo dankwa Akufo Addo wama ye 600 bed hall ewa akrokeri college education nana Addo almost enka akrokeri enka neno aye teacher training allowance mu no mu beso akwantin fi nanso nana Addo enne omo from mu say graduate papa bia na ye wadama restoration of teacher training allowances na wode ba ye no ana training allowances abanda de chemu no wa restore na wa ye biankasa adanse mind de omo say senka yo obane ye de chewa enka trinsa ye free akwa homa boy ye free sa wa ye bi de akra wanim ba ye kra wa biri.
Right, so we're still waiting to hear from President Akufo Addo about to speak at this commission of a hospital facility at Fomena in the Ashanti region. Remember that we are also heavy on health this afternoon because Ghana Health Service is intensifying medical training about this, this mosquito that is becoming an issue. There's been reported cases in the central region, in the eastern region, and what we are learning is that if you go to any health facility in the Greater Accra region, they will take time to test you on this dengue virus, and of course we'll do that. So we'll take a short break. When we return, we'll take you live to Fomena in the Ashanti to hear President Akufo Addo on the new hospitals. This is the pause. We are back in Fomena to hear the President speak.
Metropolitan Chief Executive of Kumasi Metropolitan Assembly, District Chief Executive for Fomena District Assembly, and other MMDCs, Director General of the Ghana Health Service, the contractors and consultants, Onsra Efriye II, Adansehene, Nana Amwenima Dede the second, Adansehema, Okofo Kwabna Bunsu the first, Dompoasehe, Ashanti MPP Regional Chairman, the Deputy General Secretary of the ruling New Patriotic Party, residents of Fomena, fellow Ghanaians, ladies and gentlemen. And I say, the Bible said, no one me quine, na kasa me Bible came, my can wo potom. Beso bia wo Ghana, eti free me and kasa manum de make. The on tree, need your tree na. The Bible said, no man me quine. Me so man me quine. Onana ne me. Ye de see free and you could pray achem ho. If we are dance and you could pray achem ho. Tie de, ye kan ho pa. Today is a memorable day in the history of access to healthcare services in our nation. As we gather to inaugurate the Ashanti North District Hospital, I stand before you to reaffirm my government's unwavering commitment to completing critical projects, regardless of which administration initiated them, to enhance the quality of life for our people through superior healthcare services. The completion of the Ashanti North District Hospital is a testament to our dedication to providing state-of-the-art health facilities in line with current healthcare standards across the nation. The funding of $175 million United States dollars for 6 hospital projects and 1 accommodation unit was secured from the United Kingdom Export Financing UKEF in 2012. When my government assumed office in 2017, only 1 facility at Dodua had been completed, with the others at various stages of completion. With a remaining balance of $38.8 million United States dollars, my government has since completed 3 health-related facilities in Kumawu, in Fomena, and Takoradi during my tenure as President of the Republic. This hospital is part of a broader agenda to complete numerous healthcare projects. Upcoming hospitals set for commissioning include A, 5 health facilities in Ilubu, Bogoso, Impoho, Swayem, and Wansa-Dunkwa in the Western region. B, upgrading of 1 public health facility in Akontombra in the Western North region. And C, the new Ashanti Regional Hospital at Seria. By the end of 2024, we'll also complete several significant projects, including the Urology and Nephrology Center of Excellence at the Kolebu Teaching Hospital, the construction of 11 district hospitals and 1 polyclinic in the Ashanti, Eastern, Greater Accra, and Ahafo regions, and various treatment and holding centers. These efforts align with our commitment to achieving universal health coverage, guarantee improved and more efficient healthcare services for all Ghanaians. Furthermore, government's determination to improving our healthcare delivery system is evident in the Agenda 111 initiative, which is providing 101 standard 100-bed district hospitals with accommodation for doctors and nurses in districts without district hospitals, 6 new regional hospitals for each of the 6 new regions, rehabilitating the Efian Kwanta Hospital in the Western region, building 1 new regional hospital for the Western region, and 2 psychiatric hospitals for 2 of the 3 zones of the country, i.e. the Middle and North. The entire package at an estimated cost of $1.76 billion United States dollars. 19 of these hospitals are being constructed in the Ashanti region. Thus far, construction of 86 district hospitals, 2 regional psychiatric hospitals, and the Western Regional Hospital are ongoing, which are at various stages of completion. The average completion rate of the 89 ongoing projects is 65%, with work at some of the sites being 70 to 80% complete. It is worthy to note that the constructions of these hospitals are being undertaken by indigenous Ghanaian contractors who have provided direct and indirect jobs to many Ghanaians. There's an average number of 120 workers on each construction site, and when completed, an average of 549 persons will be employed in a district hospital, 1,343 in a regional hospital, and 947 in each psychiatric hospital. This means that 67,635 people will be employed in the Agenda 111 hospitals. Ladies and gentlemen, Nananum, let me take this opportunity to assure you that the trust you have placed in my government will not be in vain. We've made substantial investments in the health sector to complete as many infrastructure projects as possible for the benefit of all Ghanaians. Today, you witness the completion of major projects on schedule. The Formina Hospital exemplifies the responsible use of taxpayers' money. We're committed to expanding and improving primary, secondary, and tertiary healthcare facilities nationwide. This includes renovating existing facilities, constructing new ones in underserved areas, and investing in advanced equipment to enhance access and quality of care. It is crucial to highlight the investments made in enhancing emergency care infrastructure, logistics, and supplies. These are essential to prepare us against local and global health threats. We've learned valuable lessons from the COVID-19 pandemic, and today we've established treatment and holding centers in Dodoa, Cape Coast, Adaklu, Seria, Kumasi South, Aflao, Elubo, and Kita to boost our emergency preparedness. Additionally, Phase 2 of the Greater Accra Regional Medical Stores for Ghana Health Services has been completed. We're also progressing towards establishing the Ghana Center for Disease Control by the end of 2024. Fellow Ghanaians, our healthcare sector has made significant strides. Our accomplishments are clear. Antenatal care average, ANC 4+, is at an impressive 85%. Skilled birth attendance stands at 64%, and 95.95% of our children are fully immunized by age 1. These achievements demonstrate our commitment to improving healthcare quality and accessibility. However, we must not rest on our oars. It is essential to continue our efforts to complete ongoing projects and meet the pressing healthcare needs of my fellow Ghanaians. The Formina Hospital is designed with several departments, including administration, outpatient and emergency services, inpatient wards, obstetrics and gynecology, surgery, physiotherapy, pharmacy, diagnostic services, logistics buildings, and staff facilities. This comprehensive facility reflects our unwavering dedication. It is a fully equipped turnkey project featuring modern medical equipment such as stationary and mobile X-ray machines, ultrasound devices, surgical equipment, medical gas supplies, and patient monitors. It is essential to highlight that the credit funds used for constructing the hospital will be repaid by the government. I urge the community to hold healthcare managers accountable for ensuring the facility's proper utilization and timely maintenance, which are vital for sustained healthcare provision. Community support and commitment to the facilities managers are indispensable. This project also includes a 2-year post-completion maintenance and training program. Therefore, I encourage the Ghana Health Service to collaborate closely with the contractor's maintenance team to ensure the hospital's effective upkeep. The contractors, Messrs. NMSI, along with their Ghanaian technical consultants, Engineer Abraham Fisher and Mr. Michael Addo, have done an exemplary job, and I extend my heartfelt thanks to all involved in the project. I task the development agents, chiefs, and local political leadership vested in the district assembly to plan the land use around the hospital effectively to create a modern enclave. There will be a rush for land, but let us not be driven by the lure of money to sell. Let us be driven by the passion to see a well-planned settlement for our children and future generations. Fellow Ghanaians, in conclusion, I want to assure you once again of our vow to delivering on our promises. I'm very grateful to the contractors, the Ministry of Health, the Ghana Health Service, Friends of Ghana, funders, and all stakeholders who have contributed resources and worked tirelessly to complete this hospital. And I don't say, O Casarode Nyama me say be too many. I say me say me ina no, I say me ina no twimo. The kind access road to the hospital. Here can say contractor is on site. Already. New Minister for Roads and Highways, they need the help on the Yura speaker, account one sem, Emma contractor, Abaswa, or Babisha Sejumana. Transform and also Minister of Health, only Ministry of Energy for Edihunkuta, young Wajuma, Kutahon, young Wajuma, Nanche, and also some Obatia Wanka. Now, town roads, ne bridge, no so no. Yeah, me guso. Me ba mo ni ma ye de metumi aye ansa no mako. And we saw the papa oba be di ma de no. Anya bi ne metumi awi ono de obeba na oba be wi enso ama. You will see I say town roads no crowd contractor is on site. It's here koya nim pa. Enkoya chiwo afi ebe ye koya chi de dada ade ayempa ya to atwene ye confirm babio mo ye confirm babio. Accordingly, ladies and gentlemen, Ananum, it is my singular honor and pleasure to declare the Fomena Hospital duly commissioned. God bless us all. May God bless us.
Right, so that's President Akufo Addo officially. He's commissioned the Fomena Government Hospital construction started some years back. Now, we'll take a short break here on the pod. When we return, we'll tell you about the threat the sea is posing to the Abuaze Power Enclave. Stay right there.